Welcome. I am Puneet Singh Braich. I'm a board-certified ophthalmologist with over a decade of experience treating conditions of the eye. I also have a subspecialty in corneal transplant surgery. The audience and the topic for this video are caregivers or patients interested in learning about corneal transplant surgery, a procedure used to restore vision in patients with corneal disease, scarring, and damage. There are different types of corneal transplant, but today we'll focus on two broad techniques: penetrating keratoplasty, PK, and endothelial keratoplasty, EK. These surgeries are used to replace damaged corneal tissue and improve vision when other treatments are no longer effective. Penetrating keratoplasty. Full thickness corneal transplant is penetrating keratoplasty, or PK. It means the entire cornea is replaced with a donor cornea. This procedure is used for patients with severe corneal damage, full thickness disease, including advanced keratoconus, deep corneal scars, or corneal thinning from disease or injury. During a PK, the surgeon removes the diseased cornea in the central aspect and replaces it with a healthy donor cornea, which is secured with fine stitches. Each stitch is thinner than a human hair. Because the entire thickness of the cornea is replaced, healing takes longer compared to partial thickness transplants, and sutures remain in place for several months. Vision gradually improves as the eye heals, but full recovery can take up to a year. While PK offers a long-term solution for severe corneal disease, there are risks to consider. Because it replaces the entire cornea, there's a higher risk for graft rejection, where the immune system identifies the donor tissue as foreign and attempts to reject it. Regular follow-up visits are essential to monitor healing and address any signs of early rejection. Let's talk about endothelial keratoplasty, a more advanced and targeted transplant. For patients with corneal endothelial disease, such as Fuchs dystrophy or secondary corneal edema, more specialized techniques exist. The umbrella term of EK comprises of DMEK and DSEK. Both of these are partial thickness corneal transplants that replace the damaged inner layer of the cornea, called the endothelium, while leaving the healthy layers intact. The endothelium is responsible for keeping the cornea clear by pumping out excess fluid. When this layer fails, the cornea becomes swollen and cloudy, leading to blurred vision. In DMEK specifically, the damaged endothelial layer is removed and replaced by a thin sheet of donor endothelial cells, which adhere naturally to the cornea without the need for suturing. One of the biggest advantages of DMEK is the faster visual recovery, especially compared to PK. Many patients experience significant improvement within weeks rather than months. There's also a lower risk of rejection since less tissue is transplanted. However, because this procedure requires precise handling of extremely delicate tissue, a DMEK is technically more challenging and performed by corneal specialists with advanced training. Which corneal transplant is right for you? Both surgeries have excellent success rates, but they also come with unique risks and recovery times. PK requires longer healing processes, carries a higher rejection risk, while DMEK offers quicker recovery and better long-term outcomes for patients with endothelial disease. Protecting your vision after corneal surgery and after corneal transplant is essential to follow all post-operative care instructions to ensure proper healing. This includes using prescribed eye drops, attending regular follow-up visits, and being aware of any signs of graft rejection or complications. If you have been told that you need a corneal transplant, our team is here to help you understand your options and guide you through the best treatment for your condition.